everybody's afraid. That's a completely normal response. And then I try to assure them that although their fear may be real, that the expectations and the outcomes of the surgery are typically quite good.
Better patients are informed and understand what is going to happen and what will happen down the road. It really helps a lot in the process of being comfortable with the procedure.
Fears of surgery in general are out there, and in spine surgery in particular. One of my jobs is not only to perform spine surgery, it's really to educate the patient and communicate with the patient, give them all the information they need to be able to make the best decision for themselves. And in reality, the risks of spine surgery are pretty low. And that's partly our technique, partly our experience, partly our technology, partly utilizing our other service lines like neurology, where we monitor nerve function during surgery. But in doing that, we've really been able to minimize risk.
The surgical procedure may last a couple of hours, but the recovery may last several months. And so I think if people understand that up front, then their expectations are real. And as they go through their recovery period, they're less fearful as they start to improve over time.
It's really just a conversation that they need to understand what are the real risks of surgery and what we do to minimize those risks. The biggest fear that I've experienced patients having is the fear of paralysis from spine surgery, for example. That's an extremely rare risk.
Patients tell me all the time that they are afraid of spine surgery. I try to alleviate that by having a conversation with them, going through what all the benefits and risks are, as well as what the expectations are for post-op recovery and long-term care.